Assalamu alaikum wa rahmatullahi wa barakatuh. Unani Day, when we were students, so we have celebrated only 10, 12 students. We decided to sit in the hostel way back in 1983 and celebrated the Mahfil Yad-e-Ajmal. Mahfil Yad-e-Ajmal, because we thought that it was the ancestor of Hakim Ajmal Khan, and then Hakim Ajmal Khan who brought this system of medicine in India. And when he established the college in his own, he devoted and he given his own land and property for erecting a college. And when he started this college, so not only Unani, he started this college Ayurvedic, and so he said Ayurvedic and Unani. So because after the burn of Iskandariya library, a lot of books of Unani system of medicine were burned, and there were a gap between the proximal and distal constitutions of the body. And you know that still today there is this gap, molecular gap, and in the Unani system of medicine there is no biochemistry, because this whatever the initial biochemistry, it was lost. So the teachers nowadays are teaching that our body is made up of some earthen element, some watery elements or liquid elements, and some fiery elements or energy, and some airy elements or rare elements. So but you know that what happened, that modern science has discovered the missing link from these elements to what is the journey from elements to the molecule. Actually, so this should be taught like this, because nowadays the students already come from after passing the 10+2 science. So to teach them that these are the four elements is not appealing them. So there will be if we give the full description from elemental theory to the molecular theory, and we include whatever is needed, the biochemistry of evolution or composition or our anatomy and physiology base, then it will be really a good base for their research, for their development. And you know that Bangladesh is a scientific country. Bangladesh doesn't tolerate any unscientific theory, and this is why that you have not presented Unani and Ayurvedic before the people of Bangladesh, before the scholars of Bangladesh, before the vice chancellors of Bangladesh, and before the government of Bangladesh and public of Bangladesh, because Alhamdulillah, Bangladesh is well educated pupils are there. Okay, some pupils are having higher degree, some pupils are having primary education only, but most of the time the new generation is educated. So in this context, it is very essential in Bangladesh that we should revise our syllabus of BAMS and BUMS, and they should be well equipped to understand the pharmacology of the natural product as well as ancient medicine, natural product as well as allopathic system of medicine. If you see scientifically, there is no any clash between Unani Ayurvedic system and allopathic system. But there is the approach in pharmacology is quite different, and here is a gap Because in allopathy, the pharmacokinetic and pharmacodynamic is very easy. Even a 10 plus 2 student, pass student can very easily understand this is the molecular structure and these are the route of administration. With this route administration, there will be a bioavailability and this your drug will be reach in your blood level will reach or tissue level will reach in such a step. So this is very easy one. Every student can do, every MBBS student easily remember it and easily they can do in their practice. But if you give any natural molecule to the MBBS professor of pharmacology, he cannot do this PKPD because what happened, this when our body, this drug, allopathic drug goes in our body regard it as a toxin and then it start behaving with this molecule as a toxin and it start neutralizing it and excreting it in a simple manner which you can study. But when a natural molecule go inside the body, because our natural molecule through the evolution and the natural molecules are not enemy to each other. They have been developed in the same environment for crores of lakhs and lakhs of years, history of interaction between these two molecules. So they do not regard it as a toxic. So first they have some interaction with this. And as a interaction, if you go through the pharmacology, detailed pharmacology of the natural product, then you will find that there are some intermediary bio complexes are there. And these biocomplexes are confined, not only go to directly to blood, but through blood they go into different tissue slowly and they are tissue bound, sometimes they are tissue bound, sometimes they lodge in a different tissue in a different way. So if you see the blood and do the analysis of the blood, HPTLC of the blood, so you will not find like that of allopathy. Because this is quite a complex phenomena. This pharmacology is very complex. So it needs a very specialized person to detect it. In India, there are 2-3 professors are there in Hamdard itself. They are in the world specialist in the for detecting the biomolecules in their body and do the pharmacokinetic and pharmacodynamics of the natural products. And there is one institute in the South Korea which can do it. Otherwise, medical colleges, they are not sufficient to do this. Now, as far as the new area, one thing is there, we are not looking towards the solution of the world or our patients or our healthcare system is having, and what solution we can have. For example, okay, surgery is well developed and there is no problem, but infective diseases, lifestyle diseases, these are very area where the allopathic system of medicine, I do not say as a system of medicine, but allopathic system as we practice it is being failed, because day by day the resistance is going on. If you go to tertiary care hospital or if you go to any microbiology lab, there are some samples, there are some patients who are having multi-drug resistance infections. And I myself had last week not only multi-drug but all drug resistance infection that was due to nosocomial infection after the surgery. So number one, surgery is okay. Only thing is, I request all the surgeons to pay attention towards the nosocomial infection which is going on, because in this multi-drug therapy prospects, they should be very, very cautious for sterilizing their instrument, because their instrument is very sophisticated, and the sterilization of the sophisticated instrument is not easy, and it is not, the technician is not quite competent enough to do the sterilization of the modern and the equipment. So the surgeon himself should supervise, because after doing the surgery, they leave the OT, and rest of the sterilization and all that depend upon the technician. Now the days have arrived that there should be some microbiologist attached to each and every not only hospital but the operation theater. They should monitor this problem. Okay, so what Unani medicine can do? The question is, okay, it is their headache, but what we can offer this? So there are some bioenhancer in our medicine. For example, you know that we daily use the black pepper or the siya mirch, kali mirch, whatever you call it. It is very common spice. So piperine is present in this. You know that piperine has been, so many other phytochemicals have been proved to be a bioenhancer. So bioenhancer means that if you give less dose of any medicine, it will act as a higher dose. Either it will reach very quickly in your system, or with a low dose, high bioavailability will be available. So we can use the bioenhancer from the Unani system of medicine. Another thing is, there are certain resistance reversal phytochemicals in our medicine. For example, the garlicin, which is anti-cancer, no doubt, but it acts as a dissolving the shell of the bacteria, particularly the bacilli, because bacilli make a protein shell and the antibiotic cannot enter it. So if you use garlicin or garlic in any product, Majuna series there, with antibiotic, so it will dissolve the covering sheets of the bacteria and the antibiotic will work. Similarly, there are some other phytochemicals present. For example, the caesalpinia or fever nut, in which there are some phytochemicals which make the efflux system of the bacteria down-regulated. Efflux system is that whenever antibiotic comes, so it throw away back from the cell of the bacteria, and there is no any effect of the antibiotic. So there is a resistance. The another way of resistance is there, that the specific protein which the antibiotic target is changed. So modification of the target. So there are certain phytochemical which can prevent the bacteria to modify its target protein. So this is not actually this is the proof theory. You can go through and you can type in the Google Scholar search phytochemical responsible for reversal reversal of drug resistance. So after finding so many things, first you will find only the cancer drug reversals. After, if you go on, you will find even the hormone resistance reversal. For example, we are having diabetes nowadays, a problem. So most of the diabetic person have do not have insulin deficiency. They have sufficient insulin, but this insulin is not working. So because there has been a resistance against the insulin, resistance due to fatty degeneration or some fat deposit in our tissues and all that. So how we can reverse this? So there are some phytochemicals. We can reverse the resistance of against insulin and against any other hormone. Similarly, our health depends upon the growth hormones or growth factors rather than this. Not growth hormone, but growth hormone up to certain age. After that, growth factor is required. Because what is the difference between normal cell and the stem cell? Because stem cells have the growth factor, so they can grow into any type of cell which are in that environment. If you put the stem cell in the brain, they will turn into the they will develop into the nerve cell, neuron. So if you put them in the heart muscle, then they will convert into cardiac muscle. So in this way, because they have a growth factor. So similarly, we have some medicine, we have some technique to stimulate our growth factors. For example, we are doing this one, al-hijama. So what we are saying? We are saying, sir, we are just putting this small injuries to suck out the bad blood. Immediately MBBS doctor will say, how you can say blood is circulating, oxygenated and deoxygenated. Oxygenated blood is also required, deoxygenated blood is also required, because it will be, there is no two type of blood in our body, bad blood and good blood. So such type of teaching should be stopped. It is we are stimulating the growth factors, epidermal growth factor. Similarly, some other process, we are stimulating other growth factors. So growth factor, there are so many growth factors. Every tissue wise, there are so many growth factors. So some medicine or some technique, we are stimulating these growth factors, which are responsible for our body's regeneration. So in this way, we are stimulating the regeneration. So our theory is there is a need to revise complete theory of our teaching syllabus, so that our students should be satisfied, because nowadays they are science, they have come from the science 10+2, so they accept the science, and our scholars of different system of medicine, even allopathic system of medicine, our biotechnologist and pharmacologist, biopharmacologist, they all accept the science. So we should, each and every step, we should speak the language which is proved by the science. So in this way, in one hand, we have to revise our syllabus on this pattern. Particular in India, because in India there is no problem, because they know that okay, science is okay, but because this is the old description, so they themselves interpret it. Whenever we say that we are just stimulating, so MBBS or especially they themselves know that because in their book it is written like this, so they are saying, otherwise they are stimulating the growth factors. But in Bangladesh, there is no so much correlation. We have directly to tell them in the scientific language. So I think that if we revise our syllabus, number one. Number two, we do the repurposing of our medicine. So I think that repurposing, if we can put a solution for the problem which the healthcare sector is facing, so I think that there is no question that they will reject our system of medicine. So why we are celebrating the Unani Day on the birthday of Hakim Ajmal Khan? Because whatever the I have put before you, the same was the Hakim Ajmal Khan's mission and vision. Because whenever he thought about the development of Unani system of medicine, he has not written any book himself, but he was having a mission. He prepared one brilliant student from Delhi, Dr. Salimuzzaman. First, he asked him to do MSc in biochemistry. He did MSc in chemistry and biochemistry. Then Hakim Ajmal Khan, on his own scholarship, he provided the scholarship for PhD, and he sent him to Germany for doing PhD in this phytochemistry, so that he can work this. So his mission was the same as I was saying, and after return from the Germany, he started a research lab, and he did research on Rauwolfia serpentina, and he find so many alkaloids, ajmalene, isoajmalene, reserpine, and all that. So one of that aim of this finding the alkaloid was some arrhythmia, for the treatment of arrhythmia of the heart, blood pressure, and all that. So, but what happened that Hakim Ajmal Khan died only in 2021, just after the establishment of the college. So, and later on, Dr. Salimuzzaman continued his work, and he did some research, and there was a trend in doing. The government of India, after independence, converted Hakim Ajmal Khan's project into Central Council for Research in Indian System of Medicine. Later on, this Indian System of Medicine, separate councils were there for the Unani, Ayurvedic, Siddha, and all that. So, so in this way, this CCRM is also a mission and vision, is a result of mission and vision of Hakim Ajmal Khan. And this is why that today at 3 o'clock, the President of India is inaugurating the World Unani Day, and it is online and offline both. So there is a link open to all, anybody can see it, and there is one good news for all the Bangladeshis, for the people of Hamdard also, because Dr. A.K. Azad, who was the who is the national professor also. I think that most of you may know he is a specialist in diabetology, and he is the director of this Bardem, I think. Bardem. So he is the first speaker there, and you can see, if you see the list, so his name, photograph, and designation is the you will find if you see the speakers of today in India, and this the Vigyan Bhavan. So his name is the first. So this is the pride for the Bangladesh, that 2 days in this year, the first speaker of the World Unani Day is a Bangladeshi doctor. So thank you very much, and I congratulate the organization of this program, the co-organizers, the various organization, chairman of various organization like Dr. Rana and others. So I thank all of them who has contributed in this program. And I think that if you continue this program, I may come from India and may join you personally. And I think that today it is a small, but day will come when the President of Bangladesh will inaugurate the Unani Day. Like that today the President of India is inaugurating. Thank you very much.